The Silent Killer in Your Sleep by Dr. Atul Gawande, Cardiovascular Health Research. Picture this. It is a quiet Tuesday night. A man named Robert, 67 years old, retired school teacher, finishes his dinner around 9:30 inches the evening. Nothing unusual: pasta, some bread, a glass of soda. He watches television for an hour, feels a little tired, and heads to bed. He has done this 10,000 times before. His wife kisses him goodnight. He closes his eyes. By 4:00 inches the morning, he is gone. No dramatic warning. No chest-clutching moment from the movies. Just silence where a man used to be. I am Dr. Atul Gawande, and I have spent the better part of my career sitting across from families, trying to understand how someone healthy enough to walk the dog that afternoon could be dead before sunrise. Robert's case was not unusual. It was, in fact, devastatingly ordinary. And what made it so painful, what makes all of these cases so painful, is that in the majority of them, the death was preventable. Not by surgery, not by expensive medication, not by some radical lifestyle overhaul, but by understanding what the body does during sleep, what certain habits do to disrupt those processes, and making a handful of changes that take less than 30 minutes total out of your day. That is what I want to share with you today. Not fear, not statistics designed to make you panic. Medical reality, explained plainly, so that you can actually use it. If you are over the age of 50, or if you love someone who is, stay with me. What comes next may be the most important thing you read this year. What your body is actually doing while you sleep. Most people think of sleep as simply the absence of waking. You close your eyes, the world disappears, and a few hours later you open them again, feeling either rested or not. But that framing misses almost everything important about what sleep actually is. Sleep is not passive. It is one of the most physiologically active states your body enters. While you lie still, your brain is consolidating memory, processing emotion, and clearing out toxic metabolic waste products that accumulate during the day, including proteins associated with Alzheimer's disease. Your immune system is running repair cycles. Your muscles are rebuilding. Your hormones are resetting. And your cardiovascular system, your heart and your blood vessels, is doing something absolutely critical. In a healthy sleeper, blood pressure drops by 10 to 20% during the night. This is called the nocturnal dip, and it is not incidental. It is essential. It gives your arterial walls a period of reduced mechanical stress. It allows the heart muscle to recover from the demands of the day. It reduces inflammation throughout the vascular system. Research has consistently shown that people who experience this healthy nocturnal dip live longer and have significantly lower rates of heart attack and stroke than those who do not. Your heart rate also slows during sleep, particularly during the deeper stages. Your nervous system shifts dominance from the sympathetic branch, the fight or flight system, to the parasympathetic branch, which governs rest, repair, and recovery. This shift is so important that scientists who study longevity consider healthy nighttime heart rate variability to be one of the strongest predictors of long-term cardiovascular health. In simple terms, sleep is supposed to be when your heart gets a break. But here is what nobody tells you. For a significant portion of adults over 50, this break never happens. Instead of resting, the heart is working. Instead of dropping, blood pressure is rising. Instead of repairing, the vascular system is under stress, and the person lying in that bed has absolutely no idea, because they are asleep. This is how people die in the night without warning. Not because sleep itself is dangerous, but because certain habits turn it into something the cardiovascular system cannot survive. Let me take you through each of these habits one by one. I want you to understand not just what they are, but why they do what they do inside your body. Because understanding the mechanism is what makes the solution feel real, rather than, like another item on a list, you will forget by morning. The first deadly habit: undiagnosed or untreated sleep apnea. I want to start here because in my clinical experience, This is the single most dangerous and most underdiagnosed cardiovascular risk factor in adults over 50. It operates entirely in the dark, literally, and by the time most patients learn they have it, years of invisible damage have already accumulated. Sleep apnea is a condition in which the airway repeatedly collapses during sleep, causing breathing to stop. These pauses can last anywhere from 10 seconds to over a minute. In severe cases, they can occur more than 30 times per hour, every hour, throughout the entire night. Every time breathing stops, oxygen levels in the blood fall. The brain detects this as an emergency. It sends a distress signal. The body jolts slightly awake, not fully, usually not enough to remember in the morning, just enough to reopen the airway and resume breathing. Heart rate spikes. Blood pressure surges. Adrenaline floods the system. Then the person falls back into deeper sleep. And 30 seconds later, it happens again. Think about what this means for the heart. Instead of the quiet, restorative night it was supposed to have. The cardiovascular system is enduring a relentless cycle of oxygen deprivation followed by emergency stress response, repeated dozens or hundreds of times between midnight and 6 in the morning, night after night, month after month, year after year. The cumulative damage is extraordinary. Large-scale studies have shown that untreated sleep apnea triples the risk of nighttime heart attack and quadruples the risk of stroke. It is also strongly associated with the development of atrial fibrillation, an irregular heart rhythm that dramatically increases stroke risk on its own. It accelerates the progression of hypertension in ways that medication alone often cannot fully address. And it has been linked to sudden cardiac death during sleep. What makes sleep apnea so insidious is that the person experiencing it often has no idea. They may not remember waking. Their partner may have normalized the snoring years ago. They may write off their chronic fatigue as aging, their morning headaches as dehydration, their inability to concentrate as stress. All of it, potentially, is the downstream effect of a heart and brain being quietly strangled every night. I treated a woman in her early 60s, a retired nurse. Of all people who came to me complaining of fatigue and high blood pressure that was proving difficult to control despite medication, she snored. Her husband mentioned almost as an afterthought during the appointment. She had snored for years. It did not seem relevant. We ran a sleep study. She was stopping breathing 42 times per hour. 42 times per hour. Her oxygen was dropping, her heart was spiking, her brain was jolting awake. We fitted her with a CPAP machine, a device that maintains gentle air pressure to keep the airway open, and within 6 weeks, her blood pressure had dropped to levels we had not been able to achieve with 3 separate medications. Her fatigue disappeared. She told me she had forgotten what it felt like to wake up and actually feel rested. She was lucky. She came in while there was still time to change the trajectory. The warning signs of sleep apnea are worth memorizing. Loud or chronic snoring, particularly snoring that is interrupted by silence and then a gasp or snort. Waking up feeling unrefreshed, regardless of how many hours you slept. Morning headaches. Excessive daytime sleepiness. Difficulty concentrating. Blood pressure that is hard to control. If any of these sound familiar for yourself or for someone you sleep beside, please speak with a physician. A sleep study is straightforward, increasingly available at home, and could genuinely be life-saving. Sleeping on your side rather than your back can reduce the frequency of apnea episodes, and for mild cases, it can make a meaningful difference. But it is not a substitute for diagnosis and treatment. This is one condition where hoping for the best is not a strategy. The second deadly habit: late and heavy evening meals. I want to be careful here not to reduce this to simple dietary moralizing, because the problem is not really about what people are eating. It is about timing, and about what the digestive process demands from the cardiovascular system at precisely the moment the cardiovascular system is trying to rest. Here is what happens when you eat a large meal. Your digestive system requires significantly increased blood flow to process that food to the stomach, to the intestines, to the liver. The heart responds by pumping harder and faster. Blood pressure rises. The sympathetic nervous system, the fight or flight branch, becomes more active. Your core body temperature increases slightly as metabolic activity ramps up. All of this is completely normal and manageable during the day. But when you eat a large meal at 9 or 10 in the evening and lie down to sleep an hour or two later, you are asking your heart to sustain this increased workload at the exact moment it should be entering its recovery phase. The nocturnal dip in blood pressure either does not occur or is significantly blunted. Heart rate remains elevated. The parasympathetic shift that defines healthy sleep is delayed or incomplete. There is also a secondary mechanism that most people are entirely unaware of. Late meals significantly raise triglyceride levels in the blood fat particles that increase the viscosity of blood and promote inflammation in arterial walls. This effect is more pronounced in the evening than earlier in the day due to the way the body's metabolic clock functions. Essentially, the same meal eaten at noon and at 9 in the evening produces different and at night worse metabolic effects. And there is a third mechanism that is particularly relevant for older adults: acid reflux. Going to bed with a full stomach dramatically increases the likelihood of gastroesophageal reflux, where stomach acid moves upward into the esophagus. Most people think of this as simply uncomfortable, but the vagus nerve runs along the esophagus, and when it is stimulated by acid, it can trigger significant changes in heart rhythm. In older adults with already vulnerable cardiovascular systems, vagus nerve stimulation from acid reflux has been documented as a trigger for serious arrhythmias, including ones that can be fatal. Robert, the man I described at the beginning, had eaten heavy late dinners his entire adult life. It was cultural. It was habitual. It was the way his family had always lived. When we reviewed what happened that night, everything pointed to a cardiovascular system that had been under sustained nocturnal stress for decades and finally reached its limit. His heart did not fail suddenly. It failed gradually, invisibly, meal by meal, night by night, and then all at once. The correction here is genuinely simple. Eat your largest meal earlier in the day. Make the evening meal lighter, lean protein, vegetables, smaller portions. Finish eating at least 3 hours before you intend to sleep. This single change, consistently applied, allows the heart to enter sleep in a state of recovery rather than labor. Blood pressure drops as it should. The repair processes that sleep is meant to enable actually occur. The difference, over months and years, is profound. The third deadly habit: going to bed dehydrated. This one genuinely surprises people. The connection between hydration and cardiovascular safety during sleep is not something most adults have ever been told, and yet it is one of the most physiologically direct relationships I can describe. After the age of 50, the body's thirst mechanism becomes less reliable. The sensation of thirst diminishes, even when fluid levels are falling. Many older adults compound this by deliberately restricting evening fluid intake, understandably wanting to avoid waking up repeatedly to use the bathroom or simply having gotten out of the habit of drinking water regularly. The result is that a meaningful proportion of older adults go to bed in a state of mild to moderate dehydration every single night. And here is why that matters enormously for the heart. Blood is approximately 55% water. When you are dehydrated, blood volume decreases and blood becomes more viscous, thicker, stickier, less able to flow freely through narrower vessels. This viscosity significantly increases the work the heart must do to push blood through the circulatory system. It also dramatically increases the risk of clot formation, because platelets in thicker blood aggregate more readily and coagulation factors become more concentrated. Now, combine this with what the heart is doing during sleep. Heart rate is lower. Blood pressure has dropped. The velocity of blood moving through the vessels is reduced compared to waking hours. In a well-hydrated person, this is fine. The blood flows smoothly even at lower speeds. But in a dehydrated person, with blood that is already thick and prone to clotting, this slowing of circulation can become genuinely dangerous. Clots can form in the coronary arteries that supply the heart muscle, They can form in the cerebral vessels that supply the brain. These are heart attacks and strokes that happen not because of sudden exertion or emotional shock, but simply because the body lay still in the night and the blood that was supposed to keep flowing quietly did not. I will tell you about a patient I will call Harold. 70 years old, former engineer, meticulous about his health in most respects, regular exercise, no smoking, reasonable diet. He had simply decided years earlier that drinking water after dinner led to too many nighttime bathroom trips and was disrupting his sleep. So he stopped. Completely. Water with dinner. Nothing after. He came into the emergency department one morning after his daughter found him confused and unable to speak clearly. Imaging showed a significant ischemic stroke, a clot blocking a cerebral artery. His neurologist noted that his blood work showed signs of dehydration and unusually high blood viscosity. There was no single cause. Of course, there never is, with stroke, but dehydration was a contributing factor that could have been addressed with a glass of water. Harold recovered partially. He never fully regained his speech. The adjustment here requires almost no effort. Drink a reasonable amount of water throughout the day. Have a glass of water roughly 1 to 2 hours before bedtime, early enough that it has time to be absorbed and to reduce blood viscosity, but not so close to sleep that it forces a disruptive bathroom trip. Keep water on your nightstand. If you wake at night, a few small sips are beneficial, not harmful. And if nighttime urination is genuinely disruptive to your sleep, speak with your physician. There are often straightforward explanations and solutions that do not involve eliminating hydration entirely. The fourth deadly habit: skipping or mistiming medications. For the significant portion of adults over 50 who take daily medication for blood pressure, for cholesterol, for heart rhythm, for blood thinning, this section is critical. And I say that not to alarm you, but because the evidence here is among the strongest and most actionable in all of cardiovascular medicine. Blood pressure does not stay constant throughout the day. It follows a predictable rhythm. It is typically lowest in the early morning hours before waking, rises sharply upon waking, reaches its peak in the late morning and early afternoon, and gradually declines through the evening and into sleep. In healthy individuals, the nighttime period is characterized by that beneficial dip I described earlier. But in many adults over 50, particularly those with hypertension, diabetes, kidney disease, or a history of cardiovascular events, this rhythm is disrupted. Instead of dipping during sleep, blood pressure either remains elevated throughout the night or, in some cases, rises. This pattern is called non-dipping or reverse dipping, and it is associated with dramatically higher rates of heart attack, stroke, and cardiovascular death than even consistently elevated daytime pressure. The reason this matters so much in the context of medication is that many people take their blood pressure medications in the morning with breakfast, which is a reasonable default, but not necessarily the optimal timing for everyone. If your pressure spikes at night and your medication has largely worn off by midnight, you are unprotected during your most vulnerable hours. Several large and rigorous trials, including the HYGIA chronotherapy trial, which followed nearly 20,000 patients over years, found that taking blood pressure medication at bedtime rather than in the morning significantly reduced nighttime blood pressure and substantially lowered the risk of major cardiovascular events, including heart attack and stroke, compared to morning dosing. These were not marginal differences. They were clinically meaningful reductions in real outcomes. Beyond timing, there is the simpler problem of missed doses. I have had more conversations than I can count with patients who skip their medication when they feel fine, reasoning that if they feel healthy, there is nothing to treat. Hypertension is called the silent killer precisely because it produces no reliable symptoms. Blood pressure can be dangerously elevated, high enough to be rupturing small vessels and straining the heart without producing any sensation whatsoever. Skipping doses on the days you feel good is, from a physiological standpoint, exactly as dangerous as skipping them on the days you feel bad, possibly more so. Because on the days you feel bad, you are more likely to take them. I cared for a man in his late 50s who had been prescribed blood pressure medication after a mild heart attack 2 years prior. He was doing well by most measures, exercising, watching his diet, not smoking, but he was inconsistent with his medication, took it most days, skipped it when he was traveling, or when he ran out and forgot to refill, or simply when the routine broke down. He felt fine. His checkups were acceptable. He had a massive stroke in his sleep on a Thursday night. His wife found him unresponsive Friday morning. He survived, but with significant permanent disability. His blood pressure at the hospital on admission was catastrophically elevated. The overnight spike, unmedicated, had ruptured a vessel in his brain. Medication is not optional maintenance. For those who need it, it is active protection. Discuss timing with your physician. Ask specifically whether your pattern of blood pressure might be better served by evening dosing. Set a reminder. Refill prescriptions before you run out. This is not complicated, it is just consistent. The fifth deadly habit: sleeping in an uncontrolled temperature environment. Of the 5 habits I am describing today, this is the one that generates the most skepticism when I first raise it. Bedroom temperature? Really? But the physiological mechanisms here are direct and well documented. And the practical fix is so simple that there is genuinely no reason not to address it. Your body has a precisely regulated core temperature, and managing that temperature during sleep is one of the cardiovascular system's ongoing jobs throughout the night. As you move into deeper stages of sleep, your core temperature naturally drops slightly. This drop is actually part of what initiates and maintains deep sleep. The bedroom environment either supports or fights against this process. When the room is too warm, above about 75 degrees Fahrenheit or 24 degrees Celsius, the body's temperature regulation becomes effortful. Blood vessels near the skin dilate to release heat, which increases cardiac output and raises heart rate. You lose fluids through perspiration, compounding the dehydration problem I described earlier. Blood pressure becomes less stable. The deeper stages of sleep become harder to reach and maintain, which means the restorative processes that depend on deep sleep, including cardiovascular repair, are cut short. Research from Harvard Medical School, examining large population data sets, found that sleeping in rooms above 24 degrees Celsius was associated with significantly elevated nighttime cardiovascular risk, particularly in older adults. The effect was most pronounced in people who already had hypertension or prior cardiovascular events, exactly the population that can least afford additional nighttime stress. But the risks of cold are equally real. When ambient temperature drops significantly, the body responds by constricting peripheral blood vessels to conserve heat. This vasoconstriction raises vascular resistance, the pressure the heart must pump against. In a young person with flexible, healthy arteries, this is manageable. In an older adult whose arterial walls have lost elasticity and may carry existing plaque, the sudden increase in resistance can be a final trigger. European mortality data consistently shows sharp increases in overnight cardiac events during cold spells, with older adults most severely affected. The cardiovascular sweet spot for sleeping temperature is between 65 and 70 degrees Fahrenheit, 18 to 22 degrees Celsius. Within this range, the body's temperature regulation requires minimal cardiovascular effort. The natural drop into deep sleep proceeds smoothly. Blood pressure follows its healthy nocturnal curve. Heart rate variability, that marker of cardiovascular resilience I mentioned earlier, is optimized. Achieving this does not require sophisticated climate control. A programmable thermostat, layered bedding you can adjust through the night, or even simply cracking a window can make the difference. What matters is intentionality, treating bedroom temperature not as an afterthought of comfort, but as a variable you actively manage for your heart. Why these habits compound each other? I want to pause before giving you the practical routine because I think it is worth understanding that these 5 habits do not simply add up, they multiply. Consider a typical evening for a person who has all 5 of these risk factors. They eat a large dinner at 9 in the evening, washing it down with wine rather than water. They take their blood pressure medication inconsistently, and tonight they forgot. They go to bed in a bedroom that their partner keeps warm. They have sleep apnea that has never been diagnosed. And they are mildly dehydrated because they stopped drinking fluids after dinner days ago. What happens in their body that night? Their blood pressure does not dip, it either stays elevated from the late meal and unmedicated hypertension, or it spikes unpredictably. Their blood is thick from dehydration, making clot formation more likely. Their heart is working hard to manage the digestion still occurring and to compensate for the vasoconstriction from slightly cool nighttime air. And every 30 to 40 seconds, their airway collapses, their oxygen drops, and their system floods with adrenaline. The cardiovascular system is not designed to withstand this. Not at 50, not at 60, not at any age. And because the person is asleep, there are no warning signs, no opportunity to pause and recognize that something is wrong, no chance to call for help until it is too late. This is not a description of bad luck. It is a description of physiology, cause and effect, operating in the dark, a practical protective routine. What follows is not a complex protocol. It is a sequence of small, evidence-supported habits that collectively reduce the nighttime cardiovascular burden substantially. Multiple studies on circadian blood pressure management and sleep safety suggest that a consistent protective evening routine can reduce nocturnal cardiovascular risk by 30 to 40%. That is a remarkable return on an investment that costs nothing but attention. By 7-0 inches the evening, finish your main meal. Keep it reasonable in size, lean protein, vegetables, moderate carbohydrates. Avoid heavy fats, large portions, and excess salt. If you tend toward acid reflux, this timing is especially important. Around 7:30 inches the evening, drink a full glass of water. If you have been active during the day or the weather is warm, drink 2. Take any prescribed evening medications exactly as directed by your physician. If you currently take your blood pressure medication in the morning, ask your doctor whether evening dosing might be more appropriate for you specifically. From 8 onward, wind down deliberately. A gentle walk, quiet reading, calm music. This is not about being rigid, it is about signaling to your nervous system that the high-demand part of the day is over. Avoid content that provokes anxiety or anger. Screens are not inherently harmful at this hour, but emotionally activating content, news, arguments, tense dramas, keeps the sympathetic nervous system engaged when it should be releasing. Around 9:00, prepare your sleep environment. Adjust the thermostat or bedding to bring the room toward that 65 to 70 degree range. Dim the lights. Light suppresses melatonin, and melatonin plays a role in blood pressure regulation. Place a glass of water on your nightstand. Around 9:30. Final bathroom visit. Empty your bladder completely. This reduces the likelihood of disruptive awakenings and removes one of the most dangerous moments for older adults, the quick, half-asleep trip to the bathroom in the dark, which carries its own risks of falls and sudden blood pressure shifts upon standing. At bedtime, if you snore, or if your partner has ever described you as stopping breathing during sleep, position yourself on your side. Use a pillow that supports the neck in a neutral alignment. Side sleeping significantly reduces the frequency and severity of apnea events compared to back sleeping. During the night, if you wake, move slowly. Sit up for a moment before standing. The transition from lying to standing causes a temporary drop in blood pressure, and in older adults, this orthostatic change can be dramatic enough to cause dizziness, falls, or even fainting. Take small sips from your bedside water if you feel thirsty. A final word. I began with Robert. I want to end with something more hopeful. In the months after Robert died, his wife came to see me. She was managing her own health, and she was also, I think, looking for some way to understand what happened. Some assurance that it did not have to be inevitable. We talked for a long time. I walked her through the habits, the physiology, the small changes that accumulate into something meaningful. She listened carefully. She made notes. At the end, she said something that has stayed with me. She said, "He would have done all of this. He just didn't know." That is the tragedy I encounter again and again in this work. Not carelessness, not self-destruction, not refusal to change, simply not knowing, not understanding that the heart is vulnerable during sleep, Not knowing that dinner timing matters, that water matters, that temperature matters, that the medication in the cabinet matters every single night, and not just most nights. Knowledge is the intervention. Understanding the mechanism is what separates someone who nods along to general health advice and forgets it by morning from someone who actually changes their behavior permanently because they understand why. Your heart has worked without pause since before you were born. It has kept its rhythm through everything, grief and joy, exertion and rest, every night of your life. What it asks of you in return is modest. A light dinner at a reasonable hour, a glass of water before bed, a room that is neither too hot nor too cold, your medication, every night without exception. And if you snore, a conversation with a doctor who can find out why. None of this is difficult. All of it is worth doing. Sleep should be the safest part of your day. With a little intention, it can be. Dr. Atul Gawande is a surgeon, writer, and public health researcher. This piece is intended for general health awareness and education. It does not replace individualized medical advice. Please consult your physician regarding your specific health circumstances, medication regimens, and any symptoms that concern you.